Hello everyone, this is Dr. Priya here and welcome to Neurotech Hair Clinic. In the last video, we discussed about which is the better DHT blocker, Dutasteride or Finasteride, and what are its side effects. Today we'll discuss about what is the maximum dosage of Finasteride that one can take. As you all know that DHT hormone is the main reason for typical male pattern baldness, and anybody who's suffering from male pattern baldness needs to take DHT blockers like Finasteride or Dutasteride as treatment. Almost 1 in every 6 men who are in the age group of 18 to 29 is affected by extensive to moderate hair loss, and by the time they have reached their 40s, half of them are already affected. The typical dose of Finasteride for hair loss is 1 mg per day, but it may vary also depending upon the amount of hair fall one is having, what grade he is in, and if he has undergone transplant or not. Research shows that 1 mg tablet per day is generally the most effective dosage to control and treat hair fall. I also get questions like what if we want to take lower dose of Finasteride? Well, if you want to take lower dose of Finasteride, it will still work, but it may not be as effective as 1 mg of Finasteride. Well, practically speaking, if you're taking Finasteride at a lower dose, it may lower the risk of experiencing side effect also, because you have to use this tablet for a longer duration of time. One can see results for hair loss after consistent use of tablet for at least 3 to 4 months. Now let's move on to the next part of this topic, which is how does Finasteride work for hair loss. Hair loss from typical male pattern baldness occurs because of your genetics or exposure to DHT hormone. DHT hormone is a byproduct of testosterone. Let me explain it to you in a simple way. We have receptors on our scalp, and when these receptors get attached to DHT hormone, hair fall happens. So when you use Finasteride, what it does is it blocks the action of one enzyme which is called 5-alpha reductase, and the job of this enzyme is to convert testosterone into dihydrotestosterone. So once you start taking Finasteride or DHT blocker, it blocks the effect of 5-alpha reductase, and thus it reduces your hair fall by almost 70%. Now let's talk about using Finasteride at a lower dosage. Well, I've mentioned earlier that you have to use this medicine for a longer period of time. And once you use it for a longer period of time, chances are there that you might experience few side effects. We are starting to notice side effects with 1 mg of Finasteride. Then lowering your dosage can make them less noticeable, or in some cases it can disappear entirely also. One can initially start with 1 mg dosage and after 6 months, when the hair fall has stabilized, we can switch to 0.5 mg dosage and continue it to maintain a lower level of DHT in the scalp. According to a study which was published in American Journal, it showed that even relatively low dose of Finasteride of 0.05 and 0.2 mg was able to cause noticeable reduction in DHT level in the scalp. Now let's talk about what is the dosage of Finasteride for hair transplanted patients. Well, after hair transplantation, DHT level in your scalp is still prevalent and can cause damage to the transplanted hair. So depending upon the grade of baldness, we design the dosage of Finasteride so that after hair transplantation, the results does not deteriorate. We initially advise our patients to start with 1 mg of Finasteride before planning for hair transplantation. And once the hair fall has stabilized, then they can plan for surgery. After transplantation, patient usually takes Finasteride for only 6 months to 1 year. And because of that, what happens is thinning starts happening in the transplanted hair and in the existing hair. So this is the reason we advise our patients to continue the medicines even after 1 year with a low dosage of 0.5 mg so that the hair transplant results are maintained. I hope this video was helpful to everyone. I'll see you again with a new video. Till then, please take care.